We'll start today's COVID-19 press briefing with Mayor John Cooper, followed by Dr. James Hildreth, President and CEO of Meharry Medical College and member of the Metro Coronavirus Task Force. Dr. Hildreth will be followed by Council Member at Large Sharon Hurt, Chair of the Metro Council Minority Caucus and the Health, Hospitals, and Social Services Committee. Also here today are Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of Public Health, who are here to help answer your questions. We'll now begin with Mayor John Cooper.
Good morning, Nashville. Based on Public Health's latest report, Nashville's coronavirus numbers remain very serious but stable. Davidson County has slowed the rate of spread of COVID-19, but our progress is not nearly enough. We must continue a coordinated response to protect the health of our residents and provide a safe platform for our local economy to reopen. Since the first days of COVID-19, our office has kept contact with business owners to understand the needs of local employers and staff during this time of immense financial difficulty. The economic damage from the virus has been widespread, and it has not been even. Nashville's hospitality businesses, especially our small neighborhood bars and restaurants, have been forced to confront the hard reality of operating a people-based, public-facing industry during a global pandemic. Now, we should adjust our response where we safely can, based on the best public health information available, to help businesses survive. This includes neighborhood bars and limited service restaurants, which serve familiar faces while having a rigorous public health protocol in place. Beginning Monday, August 17th, we will begin to cautiously and gradually adjust the dial of our current public health restrictions to enable more of our small business owners to open their doors and get their employees back to work as the data permits. Starting next Monday, full-service restaurants may remain open until 10:30 p.m., which will allow for one additional seating during the dinnertime service at local dining establishments. No other changes will be made to the operating restrictions in place for restaurants at this time to protect both workers and patrons. Limited service restaurants and bars holding on-premises beer permits, but without a license from the Tennessee Alcohol Beverage Commission, may open with patronage limited to 25 people at a time, or those who can be socially distanced according to our public health protocols, whichever is less. 25 is the same limit currently placed on private gathering sizes and allows for a number of patrons that can be easily counted by enforcement teams that will be patrolling businesses and responding to reports of violations submitted to Hub Nashville. For both restaurants and bars, no seat, no service. All customers must be seated to be served and remain seated. Stand up, mask up. Anyone standing must wear a mask at all times. All restaurants and bars must be closed to the public with patrons off the premises by 10:30 p.m., and all bar counters must remain closed. We need local businesses to cooperate with this new health order. These new protocols allow our hospitality businesses to prove that they can operate safely in the interest of public health. Enforcement teams will be carefully patrolling area bars and restaurants beginning next week. Any violation of these protocols may result in losing your license. Adherence to these orders will determine our capacity to expand any restrictions moving forward. Now, wearing a mask to slow the rate of spread is slow work, but as everywhere in the world, it has been recognized as effective. The success in our city and our state will be based on how high a percentage of the population we can get to wear a mask. Simply put, not wearing a mask keeps people unemployed longer and will cause more businesses to fail. This is why we need our enforcement efforts to include citations and arrests. Non-compliance by some punishes the rest of us, and makes us the victims of their selfishness. Order number 10 will remain in place, which prohibits the open consumption, possession, and all to-go sales of alcoholic beverages in the two specified geographic areas in Nashville's downtown core and midtown neighborhood. Order number 8, requiring cloth face coverings or masks in public places, also remains in effect. Yesterday evening, Metro Police and the District Attorney's Office filed criminal warrants against Christopher Eubanks and Jeffrey Matthews, 2 individuals responsible for the August 1st party on Fern Avenue. Both men have been charged with 3 counts of Class A misdemeanors, each for violation of Metro's public health orders, requiring social distancing face coverings and a crowd size limit of 25 people or less for private gatherings. This weekend, Metro's Enforcement Working Group will continue its enforcement campaign to ensure all residents, tourists, and businesses are abiding by our public health ordinances. Metro Police, Metro Legal, Public Health, the Beer Board, the Fire Marshal's Office, Metro Codes, Transportation and Licensing, the DA's Office, and Hub Nashville are all part of this ongoing collaborative effort. Today's new case number is 161. Nashville's 14-day new case rolling average is still green at 190.5, down from 194 on Tuesday. We are currently at 28.5 per 100,000 residents for our 7-day new case average, up slightly from 28.3 2 days ago. Now, as a reminder, anything over 10 per 100,000 residents flags the nation's and Tennessee's own standard for a dangerously high virus outbreak level. We have a lot of progress to make. Nashville's transmission rate remains green at 0.83. Our 7-day positivity rate declined by 0.2% from Tuesday, down to 13%. Dr. James Hildreth, President and CEO of Meharry Medical College, is with us this morning to further review today's COVID-19 numbers. It is also my pleasure to welcome Councilwoman Sharon Hurt, Chair of the Metro Council Health Committee and the Council's Minority Caucus, who is here to remind us all of the importance of wearing a mask, social distancing, and remaining vigilant to keep our community healthy. A national decline in COVID-19 tests has recently been reported, up to 12% in recent weeks, with southern states, including Tennessee, largely contributing to this decline. Now, testing is a vital part of our COVID-19 response. And as Dr. Hildreth has said, it helps give visibility to an invisible enemy. I urge everyone to take advantage of the testing capacity we have in place, including public-facing employees in our hospitality industry. There are no lines at community assessment centers, and the average turnaround time for test results at our community assessment centers is currently 1.6 days. Businesses should include testing as a routine part of their employee health screenings to help keep both staff and patrons healthy. And now is a great time to incorporate COVID-19 tests at Metro's community assessment centers into your workplace wellness regime. Metro's community assessment centers are open and ready to provide free COVID-19 tests at Meharry Medical College, Nissan Stadium, and the former Kmart location in Antioch. If you receive a test before 1 o'clock today, you will likely receive your results by Saturday. Remember, Nashville, don't share your air. Let's keep up the good work and protect the community and our progress. And now I'll turn it over to Dr. James Hildreth.
Good morning, Nashville. Here's some further updates on COVID-19 in our county. There are currently 2,776 active cases in our city today. This number continues to decrease, and it's actually been a month and a half since the number was that low. 87.3% of Nashvillians have recovered from the virus. This continues to improve as well, and it's the most it's been since the start of the pandemic. Our hospital capacity continues to remain stable. Today, 13% of floor beds are available and 12% of ICU beds are available. 160 patients are currently being treated in our hospitals due to COVID-19. As a reminder, as you just heard from the mayor, community assessment centers are open today until 1 p.m. If you have symptoms or if you think you've been exposed to someone who's positive, please get tested to help us fight the virus. They're open Monday through Friday, 7 a.m. to 1 p.m. And they're located, as you've heard, at Nissan Stadium on the campus of Meharry Medical College and at the old Kmart location in Antioch. If you have any concerns about the virus, have questions, please call the COVID assessment, call the information hotline. That number is 615-862-7777. The hotline is available from 7 a.m. to 7 p.m., 7 days a week. I want to just give you an update on some research that I think is really important. One of the most important questions about the virus that causes COVID-19 has been whether the virus is truly airborne and can be transmitted if it's not a part of large droplets. Observations that the virus can be transmitted in normal conversations by someone who's not showing symptoms certainly supports this idea. And also, some investigators have sampled air from rooms where COVID-19 positive individuals have been, and they've found nucleic acids from SARS-CoV-2, the COVID-19 virus. But the PCR test is so sensitive that finding nucleic acids from the virus is not the same as identifying virus. So it has not been definitively proven that SARS-CoV-2 virus is airborne until now. I want to share with you some just released data from a study done by investigators at the University of Florida. They collected air samples from a hospital room that had COVID-19 patients who were not coughing or sneezing. They were in isolation rooms. This room had a fairly sophisticated air handling system. The total air in the room was changed 6 times per hour or every 10 minutes. The air was triple filtered down to 0.3 microns, about 3 times the size of a virus particle. The air was also passed through a UV irradiation device to sterilize it. So, after all that, they took the air from the room, they subjected it to 2 things. They looked for virus nucleic acids. They also asked whether they could culture virus from the air by putting it onto cells that were susceptible to the virus. The answer to both of those questions was yes. And what's really remarkable is whether the air was collected from 6 feet away or 27 feet away, they were able to find virus in those air samples. So, despite this sophisticated air handling system that included UV irradiation to sterilize it, these investigators were still able to pull virus out of the air. And keep in mind that these individuals were not coughing or sneezing. They're simply in a hospital room that's an isolation room. The implications of this finding are pretty profound. First of all, it indicates that social distancing of 6 feet is probably not adequate to prevent transmission of the virus, especially indoors when the ventilation is poor or not adequate to move the air along. So, social distancing inside without wearing a mask gives a false sense of security. And this result emphasizes yet again how important it is for all of us, if we're going to beat this pandemic, to wear a mask. I think the evidence is now overwhelming that unless we all wear masks, we're not going to defeat the virus. It could not be more important to do so. This study should inform decisions about reopening schools, churches, certain sports venues, and many other things, especially where large numbers of people will gather and the ventilation is not adequate to change the air frequently. So if the virus remains in the air in an isolation room in a hospital that changes the air 6 times per hour, UV irradiates the air, filters the air 3 times, and you can still find virus, what makes us think it's safe to open a school where the ventilation is poor and HVAC systems are outdated and outmoded? I'll leave you to think about that. Also, if resources are not provided for the teachers and students to have PPE when they need it, whenever they need it, that's also something to think about. I realize these are very stressful times for parents of school-aged children, and it's well understood that the emotional and social well-being of children is probably best served by them being in a school. On the other hand, it is now beyond dispute that children can be infected, will be infected, some of them will get sick, and unfortunately, as we know, some of them will also die. And keep in mind, another point I mentioned before, in past pandemics, those who recover from coronaviruses have long-term consequences that go well past the time they recover. We don't know this won't happen in children, and we can predict that it will based on what we've seen in other pandemics. So that's something we need to think about. And please consider this. When our children get sick, we call a pediatrician. If our roof leaks, we call a roofer. If we're having problems with our teeth, we do not call an auto mechanic. We call a dentist who's been trained to take care of that problem. My point is this: with all due respect, some of our elected leaders who are pushing to open schools the hardest are the least qualified to know if it's safe to do so. And they're refusing to listen to the public health experts who spent their whole lives and careers studying these things. So, my advice to you as you make the difficult, stressful decisions about whether to have your children in a school, please listen to those who spent their whole lives and careers studying and determining whether or not it would be safe to do so. And I can't emphasize enough, based on what I've just shared with you, how important it is that masks be worn by all of us, because if we don't do that, the virus is going to continue to win. And with that, I'd like to turn it over to Councilwoman Sharon Hurt.
Thank you, Dr. Hildreth, and happy Left-Handers Day. Good morning. I am Sharon Hurt, Councilwoman at Large. On next Tuesday, August 18th, we will celebrate, honor, and encourage the ringing of the bells to commemorate the 100th anniversary of the ratification of the 19th Amendment in conjunction with the opening of Votes for Women at the Nashville Public Library. We will also vote on Resolution RS 2020-454 in support of the Metropolitan Public Health Department Chiefs, Medical Directors, order mandating cloth face coverings or masks, and further urging all citizens, residents, and visitors to Nashville and Davidson County, Tennessee, to adhere to the order and observe proper facial coverings when indicated. Let me show you the different masks that are most effective to wear to reduce the spread of COVID-19. The N95, the surgical mask, and the cloth mask. Those that are less effective, the bandanas and the gaiter, they're popular, but they're less effective. Don't get me wrong, nothing is 100%, but something is better than nothing. New data shows that the University of Tennessee survey finds over 70% of Tennesseans support mask orders. It is much like seatbelts to bike helmets, where the result of legislation has helped save lives. As elected officials, we receive hundreds and even thousands of emails weekly with citizens voicing their opinions, and yes, most of them are likely to be half and half for, half against, no matter if it's transportation, Airbnb, homeowner businesses, and masks. It is our job to help find a balance between all those issues. Is very difficult to do. With the mask, however, there is a current mandate by our Metro Public Health Department chief, and this legislation is requesting the council to formally support its enforcement. In Arizona, which not long ago faced the fastest spreading coronavirus outbreak in the nation, a rise in the use of masks combined with short-term closure of bars and some businesses helped dramatically reduce hospitalizations and infection rates. The progress in Arizona is so dramatic that even the White House specifically recommends that Tennessee follow its lead. We need to take the politics out of encouraging our friends and neighbors to wear a mask. We need to do it for people like Jason Hargrove, a Detroit bus driver who died 2 weeks after posting a message on Facebook that he felt violated after a passenger deliberately coughed on him while boarding the bus, and the Mockingbird restaurant employee who was recently coughed on here in Nashville. For Jason and others in our own community who have had loved ones taken too soon, politics are not at stake. Lives are. The science is clear, and we must mask up to help protect all Nashville residents, including our most vulnerable populations. Most people who die from COVID-19 are Black and brown, many from underprivileged and marginalized communities. The fight against COVID-19 and its impact on underserved communities here in Nashville is too important to allow something like this to be reduced to our focus on saving lives. Whether you are a Democrat or a Republican, Black or white, gay or straight, young or old, we want all of our community members to protect themselves and their families against COVID-19. Prevention is always the best cure. Mask up.
Thank you, Councilwoman Hurt. We'll now begin taking media questions. Let's start with Julia Palazzo at WKRN. Julia?
Good morning. Thank you. Just 2 questions for the mayor. Mayor Cooper, have the Titans submitted a written plan to the city about what they intend to do about home games this season? And second, we saw that Councilwoman Welsh sent out a message sending positive thoughts to former Councilman Tony Tenpenny about him fighting COVID-19 in the ICU and also his family. Do you have an update on how he is doing? Thank you.
Thank you, Julia. Mayor Cooper?
Thank you, Julia, for your question. We are working with the Titans. Very quickly, I do think there's a wide variety of responses in the NFL in the approach to the disease. I think you've got, again, at least 3 or 4 different paths. There are lots of separate dials to address as each community assesses the risk in that community at this time. I think all of us are rooting to get back to normal, and I do expect announcements on this over the next week or so. As opposed to former Councilman Tenpenny's illness, I'm sorry to hear this. This is the first that I've heard about it. Our good wishes go to him and to his family, and let's just use this as a reminder that the virus can strike us all at any time. And then to our seniors, and I know Councilmember Tenpenny probably would not object, like that he is in a risk category, and that group of Nashvillians must be constantly vigilant to protect themselves and the community. They are often our most at-risk citizens. Thank you.
Brett Kelman at the Tennessean. You're on the air.
Good morning, everyone. I wanted to revisit the change to the limitation on bars. It sounded like there was some nuance in there based on what type of license they had, and I just wanted to revisit that to make sure it was understood. The mayor mentioned bars that had one kind of license but didn't have another kind of license, and I don't know what any of that means, so I would really love it if we could review.
Sure. Dr. Caldwell will review that for us.
Morning, Brett. The Alcohol Beverage Commission of the Tennessee has two main types of licenses. One is a restaurant full-service license, where typically those are facilities that make more of their money from food than alcohol. There's another license called the limited service license, where most of those places, over 50% of their receipts are from alcohol. So those are the two main types of permits that are given out by the Alcohol Beverage Commission. In the previous order, we had just closed those with the limited service license, and we allowed those with the restaurant license to be open at 50%, and those remain. That's not going to change. But now, the mayor has announced today that those with the limited service license will be allowed to open at some limited capacity.
Let me, Brett, just take a moment to part of the, it was in my regular talk. 25 is the limit currently placed on private gatherings, so it includes this group in that limit that we've had for a period of time. We are hopeful that under the strict supervision of a well-managed, adhering, limited service restaurant or bar, that is better than people going to a backyard where they are permitted to gather at 25, and probably will have a more relaxed atmosphere rather than a well-supervised atmosphere, and that will allow these facilities, which primarily are serving neighborhoods, familiar faces in neighborhoods, to get back into business and to do that.
Our last question today is from Jason Steen, Scoop Media.
Hey, thanks for taking our questions. My question is for Sharon Hurd this morning. Last week, Councilwoman Hurd asked a council committee if legislation could be created locally to criminalize the unmasked transmission of coronavirus, and she cited similarly to the way that knowing transmission of HIV was criminally prosecuted, citing an attempted murder charge. I'd like to ask if she's still seeking such legislation and how she feels such a drastic charge is appropriate.
Councilwoman Hurt.
Thank you for your question. In that meeting, I asked if there were a need for there to have stricter legislation as it relates to that, not necessarily suggesting or proposing legislation to do such. I do believe that there are some viruses where there is criminalization of the transmission of those viruses that I think are too harsh. And I do know that people mostly comply when there are rules. And when they have the freedom to do whatever it is they choose to do, we're less likely to have the type of cooperation that we need with this particular virus. Considering we don't have much information about it, as you heard Dr. Hildreth earlier give us much more information as it continues to unfold each day. You know, my position is it's better to be safe than sorry. So it's really not about the criminalization and proposing such legislation, but the fact that we make sure that we keep others safe as well as ourselves.
Those are all the questions we have this morning. I'd like to thank Dr. James Hildreth and Councilwoman Sharon Hurt for joining us today. And as always, we're grateful to Amy Lankheit and all our partners at Bridges for the Deaf and Hard of Hearing for providing ASL interpretation services at our press briefings. The next scheduled Metro COVID-19 press briefing will air on Tuesday, August 18th at 9:30 a.m. Thank you for joining us.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, Or for more information about this and other programs, visit nashville.gov.